Hi,
We should
everyone.
just stare at each.
Yeah.
That's one of the things we never actually talked
What's
about.
that?
We had never actually talked about it, and I know we usually do. Like, who's gonna start and introduce? And
Who's gonna go first? I know, and it was funny. I panicked. I panicked because I was like, if there's a pause, then
either
that's
we
not good.
stare
So I'll
at
just
each
jump in,
other.
and then we both jumped in.
That's the way it goes. All right. Well, let's play this tag team. Hi, this is Nate Dodson, and
Alrighty. I'm Jillian Sidoti. Thank you so much for joining us today. This is I don't want to call it a depressing subject. It's not.
it's pressing for the nation, but it's been
Yeah.
on this slow train wreck for decades now. Of course, we're talking about healthcare. Yay.
Mhm. 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 Yeah, I mean, and by the way, welcome everyone, welcome. So, one of the things I've always found challenging as an entrepreneur is navigating healthcare, and I know the whole reason we even came up with this subject is because Nate and I inadvertently, in just random conversation one day, shared with each other that neither of us have had actual health insurance for many years. So, Nate, I'm gonna ask you, because we never talked about it. I said, "No, no, no, don't tell me, wait for the live stream." How did you end up learning or deciding, I guess, that you weren't gonna carry health insurance anymore?
Okay, well, this is like literally going back to childhood, as goofy as it is. I had a physician father. And
Oh,
so we got like that back scratching of like, hey, we take care of our own. And that kind of followed me into, well, healthcare, it's important, but the whole system that we got of have this insurance to make sure you get drugs or you see a doctor, and it just didn't make sense to me. And so forever been just paying cash. Being
mhm,
one of those
mhm.
cash pay people, it just makes sense. But then at the same time, and now sharing what we're doing today, I did always have that catastrophe insurance, that
Yeah.
massive $10,000 deductible. But you know what? If you end up in a hospital, it doesn't matter if you stub your toe, it's going to be 30 grand.
Yeah.
So
Yeah, yeah, yeah.
I always had that as a minimum, but at the same time, it didn't meet the Obamacare, the Affordable Care Act requirements. So it wasn't until then that I actually kind of did this deeper dive into personally what made the most sense. And I definitely want to talk about the business side of things as well. But so personally, I still have a quasi catastrophe policy. It's through a religious organization, which you are allowed to have, religious insurance plan that's not really insurance
Yeah, yeah.
without having to pay that penalty with Obamacare. So we started there and then took it one step further. Instead of getting just a regular insurance, because you know what? You got to see the doctor sometimes. You need prescriptions sometimes. You need an annual physical. We sign up for a concierge doctor. That's maybe a quarter to a third the cost of insurance.
Yeah.
Tack that onto the cost of the catastrophe coverage, and we're paying half as much as what anybody else seems to be.
Right, and we're gonna get to these solutions, and we'll tell you exactly how to do this by the end of this live stream. And we also want to encourage you that if you have any comments, questions, cussing, discussing that you want to add, please put them in the comments below, and we'll get to them before the end of the stream. My experience was a little more dramatic, and less of a slow,
Train wreck.
tumble down a hill, I suppose. It was it was sped up very quickly. When my, now 14-year-old son was born, I called my insurance company at the time, which I think was Anthem. I don't remember if it was Anthem or Blue Cross Blue Shield, but it was one of them. And I called him at the time and I said, I need to add my new infant baby to my policy. And this was in 2010. And they said, okay, no problem. He's added. Your deductible is not my deductible, excuse me. My premium is tripled. I was paying at the
Pre-existing conditions of he was born.
yeah, yeah. So I was like, whoa, 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 whoa. I mean, I was a young entrepreneur, right? So with now 2 kids, and I literally I think I started crying on the phone. I said, "Excuse me?" I said, it's just a baby that I'm adding. It shouldn't have to triple my insurance." And I will never forget what the guy said to me. He said, "No, everybody's is going to be going up whether you add someone or not because of the Affordable Care Act. So anybody who's calling from now on is going to be immediately placed on the new plan. You can't change your policy at all without changing to the new policy that's ACA compliant." And
Yep.
I just died because I could not afford that. It went from uh 450 a month to something like $1,200 a month just for the premium, and I was on a high deductible plan, like $8,000 a year. So, I was gonna be spending, uh I would have to spend, 20 to $24,000 before I even got coverage. It didn't make any sense to me, and it still had co-pays and all this other nonsense. So, I called either Anthem or Blue Cross Blue Shield. So, I was at one and I switched to the other. I called the other one and I said, um, "I can't do this. I can't b buy triple insurance. Do you have a plan for me?" And that second insurance company is like, "Yeah, sure, no problem. Here's your new insurance policy." So remember, this is November. By February, that new insurance company called me and said, your policy is being canceled. You'll have to choose from one of our many other ACA compliant policies." And that's the last time I've ever had health insurance. I did a very similar plan as you did. And I know we're going to talk about, what can entrepreneurs do, not just for themselves, for their employees. And I'm going to talk about what I've done for my employees in the past, and you can talk about the law and how that looks as well. But look, I've always tried very, I've tried very, very, very hard to not be critical of Affordable Care Act because I've always thought, well, at least it's something. At least people with pre-existing conditions can now get insurance, et cetera, et cetera. But honestly, I know more entrepreneurs who are like us in our situation who don't have coverage. I know more people who actually have coverage and then things are simply not covered. So sure, you, the individual who has a pre-existing condition, is covered, but your condition is not actually covered. And I mean, tell me one statistic. What are the challenges you see in the current system, Nate?
Well, we've all seen the difficulties in the system where the big overriding question is what's medically necessary. And
Mm.
that's been like the basis of so many problems. To give you an example, I was listening to some other podcast and the guy was trying to find a doctor for a condition that he had. Insurance gave him
Mhm.
a list of 20 doctors that were in network. He called all 20. Not a single one of them was taking new patients.
Oh,
So
wow.
none of them. So he ended up having to go out of network because there was literally no other option. And now all of a sudden the insurance was like, yeah, we don't really cover that because it's not in network. So good luck. I mean, literally, what a horrible situation. But at the end of the
I
day, it is non-doctors making your medical decisions. Some company with a profit interest, how do they know what's medically necessary? They're not the experts.
Yeah, you know what? It's so funny you said that. I read somewhere that doctors can't own hospitals. Is that true? I can Google that real
They
quick.
can definitely own hospitals. There are some self-dealing requirements where you can't pay to play, you can't get paid per patient that you deliver, and physicians have traditionally gotten around that you can't get paid for referrals by owning where the referrals were going. And that actually did cause a lot of issues, a lot of problems. If a hospital would pay a commission for a referral to a doctor, it's actually bribery.
Oh. Oh, interesting. Okay. All right. So here's I just found this article from the American Medical Association, and it's an opinion piece, right? It's written by a doctor. It's called End Restrictions on Physician-Owned Hospitals to Expand Quality Care. Fostering greater competition by dismantling barriers to physician ownership of hospitals will provide patients with another option to receive high quality care through integrated coordinated care delivery. I guess I get that to a certain extent. If you're like a physician in private practice and you refer a patient to a hospital that you own, right? Like, is that where the I guess I don't
That's
understand this very well at all.
that's the crux of the entire issue.
Mhm.
Ownership, well, is it really in the patient's best interest or your own? I know one of the strategies that physicians do use is they may own an interest in a surgery center that
Okay.
their
Oh,
patients need rather than a hospital. I mean, really minute differences, but now they're allowed to own over here. There's restrictions over there. And again, if they get paid for that referral, I literally have a ex-client now that went to prison for 5 years over getting paid something, anything, for sending clients to a hospital. I mean, it can be that strict.
wait, hold on a second. Wait, what are the Okay, so your client went to prison, who's a doctor, I'm assuming,
Yep.
and he made money. How much money are we talking? Do you know?
To make it a little bit more convoluted, he was part of a group and all of these doctors went down. The biggest payout doctor, it was like 15, $20 million. Like it was big money. My client, and it's all public information, but I'm not going to share his name. It was like 70 grand, but he still got caught up in the entire suite because there were some physicians that were absolutely abusing the system. Exactly why these rules are in place. Yeah.
Okay. All right. So he was part of a bigger thing, even if but he's going to jail. He went to prison for 5 years.
5 year sentence. Who knows how long he actually had to? I mean, this was now years ago,
Oh, I see.
but it was
I
a
see.
5 year sentence just for being a part of this medical group.
Oh, wow. Oh my God.
But that's just
That's
scratching the
horrible.
surface
Yeah.
on what the issues and problems in healthcare is. And frankly, anybody listening really doesn't care about this doctor that did something wrong.
No, but
They
I
care
think I
about themselves.
well, sure, and we're gonna get to solutions, but I think the issue is for me right now is like and another thing that spurred this particular live stream was I was watching a live stream of a young comedian I watch on TikTok, and she was talking about how she's in LA and she's okay from the fires, but what she's not okay from is that she literally went to the pharmacy to get her epilepsy drug refilled a drug that stops her from having seizures. And she was told by the pharmacy, this drug is no longer covered by your insurance. And it turned out that all of these drug companies, January 1st, put out, or excuse me, insurance companies put out these um lists of drugs they are no longer going to cover, and and that they're not covering all kinds of different drugs, including several different types of insulin. I gotta show you this list because it's
I I
absolutely,
read the same.
um, horrifying how big this list is while I pull that up. But, this is what I'm talking about, and her issue is this is the only drug that I found to work for me. It's the only thing that works. Um, and it's $1,400 a month. Americans by far pay higher prescription prices than any other country in the world. We're
I
basically subsidizing drugs for the rest of the world.
We're paying exponential amounts, but that's part of the problem with the system is that doesn't really affect us generally directly because insurance is supposed to pay it. But what if insurance doesn't pay it, which is part of what's going on right now? And that's who, hey, I need insulin. You're telling me it's not medically necessary, or are you just telling me that even though it's insurance, you're not going to cover my care? No matter what, it's a problem.
Well, listen, I think the argument that listen, the insurance companies are let's just be real for a second. Luigi Mangione didn't act because he hadn't been hurt by a system that doesn't care about anybody. These insurance companies are making money hand over fist. They come up with plans on how they're going to deny. And their argument is you don't need this drug. You could have a less expensive drug and you need to research that first. I will say, like I'll play devil's advocate for a second and talk about the insurance companies. Like, I am sure that this country is filled with hypochondriacs who just wanna take drugs to treat their problems and not look for other solutions like eating better or exercising more or getting more sunshine or meditating or doing any number of things that could naturally help their conditions. Americans are known to want a quick fix. But when you're talking about like a young woman who has epilepsy, I don't know a lot about how you get epilepsy or how epilepsy occurs. And she has found a drug that works for her. I don't understand how you can deny that coverage so callously. And it reminds me of when I was pregnant with my first son and I couldn't stop throwing up. I couldn't stop. Like there was not like water made me sick. I couldn't stop. So and I had to go to the emergency room twice to get IV fluids. And the doctor at the time, prescribed me Zofran, which is a, well-known anti-nausea medication that they was originally introduced to help chemotherapy patients and then was found to be safe for pregnant women as well. So they prescribed me the Zofran and there's no generic. So I have to get Zofran and it's $25 a pill, which, seems very little, but when you're talking $50 a day because you have to take it twice a day and you're a pregnant woman entrepreneur, that's a lot of
30
money,
days a
right?
month.
So my insurance at first covers it and then they stopped covering it. Like they wouldn't cover it anymore. And I'm like, so should I just go back to the emergency room when I start vomiting again? I don't understand. Like, is you paying for me to go to the emergency room? I think this is a real problem is that these health insurance companies don't believe in prevention. They believe in emergencies. Like, if you're not dying, then we're not going to help you. So let me just show you this real quick because I think this is pretty telling of what what these insurance companies are up to. This is the list. Okay. No, 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 not that. It's 38 pages long. Look, removed from coverage. Look at all of these removed from coverage. This is a 38-page document. How can you say this is covered? And now for this year, all at once, none of these are going to be covered. This is incredible.
And I think that's
Government.
kind of the big question is like we have this Affordable Care Act that basically created monopolies because now you have to have insurance. But if insurance doesn't cover your medical necessities, is it really meeting the requirements that we're forced to buy? I don't even know.
Oh, I don't think so. I mean, look, there's got to be some change. It's going to take some really zealous um senator
Ouija.
or a representative that is going to make this their cause. And Nate, I'm libertarian at heart, but I will tell you firsthand. I saw that Michael Moore documentary. Yes, I was brainwashed by Michael Moore. I saw that Michael Moore documentary that he did after it wasn't after 9/11, but it was many years after 9/11, and it focused on first responders of 9/11, people who were down there at the scene and who had lung issues and how they couldn't get health care. And we know John Stewart is taking care of that, but the point of that particular documentary was to shine a light on the fact that our healthcare system in the United States is so broken, is so driven by profits. It's hijacked by private equity. It's hijacked by these private insurance companies who are profits over patients. And yeah, we're going to need some real change. For me, you know, um, it's kind of the one thing I don't mind paying a little extra in taxes for if we have a system that works and works for everyone, not just a segment of the population. And that's my huge problem with ACA is that um it 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 it, it it's it is on those who are below the poverty line, right? Well, if you're an entrepreneur making, let's just say $100,000 a year in your business. So you're making six figures, but then you have employees and overhead and rent and costs of goods and services. It's not a lot of meat on the bone at the end of the day. And based on certain insurance plans, you could be making $55,000 a year and spending $8,000 a year on health insurance. It's bankrupting people. It's the number one cause of bankruptcy in this country. How shameful is that? That we're the richest country in the world, most technologically advanced, and we can't provide for our people. So
Well, I definitely
yeah,
think there's, and would love to talk about some of the hurdles of actually making change and what that change should be. But let me speak to the entrepreneurs for a second,
yes, please.
because there are some components that actually make it easier or better for the entrepreneurs, whether they're more experienced or just starting out. And you nailed it if you don't have a higher income. And let's be frank, $100,000 still puts you at almost the 80th percentile. Average income is $40,000, give or take.
Right.
The Affordable Care Act, the marketplaces do help in those cases. And if you're just starting your side hustle and you're just getting started, you're maybe not making a whole bunch of money, there are solutions for you there. But to speak to the entrepreneurs that have already gotten started and literally had no clue that this even existed before doing a little research for today, there is a small business healthcare, I know that, options program. They just had to figure out that great acronym to make it SHOP. But there is a program. It is under the Affordable Care Act. It is for entrepreneurs, for businesses that have employees. You can leverage this if you have 2 to 50 employees. But they will actually give you tax credits for offering to your employees healthcare benefits.
Oh, that's awesome. How much in
And
tax? So you get a tax credit. So if you offer healthcare to your employees, then you get 50%. I think you told me earlier it was 50% of that back in tax credits.
it's up to, I played around with the calculator, which made absolutely no sense.
Oh, really?
But yeah, it's so convoluted and complicated. It is available at healthcare.gov,
Okay.
and it's like small business. But I put in assumptions that I'm paying $20,000 per year for my employees. And it responded that I get like $9,500 back as a tax credit. The remainder is still deductible. So actually, there is some potential that this shop, small business doesn't even make sense acronym, can be put in place that tax-wise, it can actually support getting insurance for your employees.
That's great.
And
Yeah, I
not many
never
people
got
know.
insurance. Yeah, I never got insurance for my employees. Not because I didn't want to. We went to get insurance multiple times and didn't have either a big enough group or it was so cost prohibitive, like the business couldn't afford it. So what I ended up doing was paying for a solution that I paid for myself that we'll get to in a second. So I do want to address, what Nate and I were preparing for this yesterday and we were talking and we were going back and forth and talking about a lot of different things. And one thing I admitted to Nate was, I don't know the answer. I don't know the answer to this problem that we have, but I know that this problem that we have as a nation is not a good problem. So, what did I do to figure it out? Well, I asked ChatGPT, of course, the smartest being on the planet, apparently, because I will tell you, I could not believe how adept ChatGPT was at solving this problem. Okay, so this is what ChatGPT said. Fixing the American healthcare system requires systemic changes to address affordability, accessibility, and quality of care. We can all agree with that. All right. So, what are the policy reforms we need to have? Price transparency. Yes. Yeah. Oh my God. Price transparency. Like, why is it, Nate, that you and I, as lawyers, have to tell our clients exactly how much they're going to pay, how much things are going to cost? But going to the doctor or the hospital doesn't require that at all. That's required in most countries. You could go online right now because I looked into this. I looked into medical tourism in quite a few countries. Uh, you can go online right now and go to a hospital in Costa Rica and find exactly what it's gonna cost you to have a baby in that hospital. They have the prices published right online.
Let me share with you why that is impossible to change. And besides the impossible to change, just that there's too much money being made from the system to allow people to, or allow the powers that be to
Mhm.
effectuate change. But I have done deals where I actually helped investors acquire and fund private equity, freestanding emergency room centers in Texas. And I learned so much
Oh,
about
yeah?
how the medical systems works. And this is why they can't be transparent. And it's a horrible justification, but the insurance companies don't pay what you're expected to pay. And there's almost three levels. There is, if you just go in and say, I'm a cash pay, they will give you a price. You pay that, you move on down the road. If you have insurance, they try to get as much from insurance as possible. So you're going to find that the insurance price is at least triple what you can pay in cash. But the insurance companies refuse to pay everything. And that's just their standard operating procedure, where really they're going to pay 25% to 40% at the maximum of what is the bill that is submitted. So they have to charge more over here to get the same amount. But then if the insurance doesn't cover it, here's where the real problem is. then the medical provider can go directly at you for 100% of what they billed the insurance for,
Oh, so in a lot of ways, these medical centers are protecting you from them by charging your insurance a
unless they
ridiculous
can't get the
amount of money.
money from the insurance. Then they're going to charge you more than what you would pay if you just say, hey, I'm going to pay cash.
Everything's ridiculous. So, but yeah, but if you put price transparency across the board for everything, um, I don't know. It's weird because then, okay, you have price transparency, and then I also think if you do have some kind of level of price transparency, then you kind of create a competitive market as
Oh my God,
well, right?
capitalism, the invisible
Yeah,
hand.
yeah, yeah. I mean, like, well, I mean, yeah. I mean, honestly, I don't think that's not all, right? So, the other thing we could do that I thought was genius on the part of ChatGPT is okay, so if we can't do universal healthcare, because I kind of get why people don't want to do universal healthcare. If you have
I
people
know.
who don't, okay, let's take something like if you if you drink too much and you get cirrhosis of the liver, and or you smoke, and we all know you shouldn't smoke. We all know it causes lung cancer. Or you do some other thing to like destroy your body, and then you want me to pay for it from a universal healthcare.
You are
um
anyways.
it's what?
You are anyways. That's the entire
Yeah, well,
point
right,
of
right.
insurance.
Yeah. Yeah, right, right. But my point being is like, so I get the arguments against universal healthcare, but what we could have is something like universal catastrophic coverage, where like if you have a catastrophe, like a terrible accident, or you get cancer, like an unpreventable cancer or something like that, then maybe or you get like Lou Gehrig's disease, something that's not preventable, that does need serious care. Why don't we have like a universal catastrophic coverage in this country? We certainly could afford to pay for it.
It's a baby step of a much bigger problem. So now you're removing the insurance's obligations to cover part of it. They're already denying coverage for the other part. However, we're required to buy it from them. It's
Mhm.
kind of one of those things that it probably has to happen across the board,
Right.
or it could never happen anyways.
Well, sure. Okay. And so then the other thing is we have to reform drug pricing. Listen, I use GoodRx all the time. I don't know. Do you ever use GoodRx? Yeah. I
That
mean,
is my insurance for
yeah, yeah, good.
medication.
Yeah. So GoodRx, for those of you that don't know, is basically like a coupon service. You don't have to pay for it or anything like that, although there is a pay for membership, I suppose. But GoodRx is basically, it tells you where you can get the drugs the cheapest. So for example, my one of my kids recently was on Accutane. He absolutely needed it. It was a medical necessary. I paid cash for it. And before I went to get the prescription filled, what you can do is you can go on GoodRx and find which pharmacy will sell it to you for the cheapest price. That's ridiculous.
What I think is
Accutane's a drug
ridiculous
that's been around forever.
is the massive difference between the lowest prices and the highest prices for the exact same thing, just depending on where you go to. But those prices aren't advertised. You have to go to something like GoodRx, which is awesome,
Yeah,
to even be able to price shop, which has been basically impossible in the healthcare industry in general.
sure. Yeah, but I hate the fact that GoodRx even has to exist, you know?
Agreed.
I mean, so that's another thing. Another thing is, a big problem at hospitals in particular is administrative costs. And I will tack on to administrative costs medical malpractice insurance for doctors.
Mhm.
I remember, again, pregnant with one of my kids. I don't remember which one. And I was in my OBGYN's office, and he's an older guy, and he's been running this practice for forever and ever and ever. And, what have you. And we were talking one day, and we were talking about malpractice, and I was talking about my legal malpractice insurance costs and how, securities attorneys have the most expensive legal malpractice insurance um, because it's such a intricate area of the law. And I said, I noticed that OBGYNs have high insurance too. And I said, yeah, so for my firm, I pay like $30,000 a year for this insurance. And he's like, yeah, I pay $60,000 per doctor per year. I, I think on some level we have to reform. There's true medical malpractice, and then there's, look at, maybe we're not that advanced in our medical technology, and sometimes things happen. So I also think there's got to be some kind of medical malpractice law reform.
And let me, from the attorney perspective, it's really interesting going across the country and seeing the different ads. And you've all seen it. Every freeway has those attorney ads. Personal injury, hurt now, get in a car wreck, whatever. You go to California, you go to Nevada, and you see these massive signs everywhere for personal injury. What you don't see in Texas are there's caps on how much people can recover.
Oh, really?
So where it gets interesting is the purpose of the advertising. California, they're just saying, you have any injury, we're ready for you. In Texas, they're looking for 18-wheeler injuries because that gets them outside of that cap. But it starts to fix that problem. But I actually,
Yeah.
what you're talking about, I very personal in the effect, because I just shared my father was a physician. He got sued once. On a long enough timeline, everybody gets sued.
Right.
His malpractice insurance quadrupled. Not without any finding of responsibility, just the fact that he got sued, and anybody can sue, whether
Yeah.
it's valid or not. But he looked at this and said, well, guess what, guys? It's just not worth it for me to practice anymore.
Right.
I'm out.
Yeah. Yeah, no, because you certainly don't want to have the liability of not having insurance, right? I find these insurance companies are too quick to settle too, right? They're just like, oh, we'll just throw money at it, because you have, I mean, that's the problem with lawyers, right? Is if they smell an insurance policy, they'll go straight to mediation to see what
Deepest
they can get.
pockets. All right.
Yeah.
What other
So.
solutions we got?
All right. So then also, all right. Well, look, we're not going to solve the problems for the American healthcare system, but those are some things that I think could really help. And then also, convincing these insurance companies to focus on preventative care. I'm sure they've done the numbers. I'm sure they have actuaries who know that perhaps, fighting expensive diseases is better than focusing on preventative care, but who knows? But I will say this, your point about the insurance company. The other day, I took one of my kids to go get an immunization. He needed like 2 or 3 immunizations, I don't remember. And they asked, "How are you gonna pay for this?" And I said, or they asked for my insurance, and I said, "I don't have insurance." And they said, "You don't have insurance?" They're like clutching their pearls. And I'm like, "Yeah, I don't have insurance." And they're like, they look at me like, "Oh, you poor thing." And it's like, "No, really, I'm okay. I haven't had insurance for like 14 years." And they're like, "Oh, okay, so you're gonna pay cash?" And I said, "Yeah." They're like, "Okay, it's $10." I'm like, "Well, what was that all about?" Like, "It's $10." Like, "Yeah, I can fork up the $10. You're gonna charge my insurance for $10?" No. They were gonna charge the insurance because they gave me the bill that would have gone to insurance. They were gonna charge the insurance $110. $110. So, and of course they want you to have insurance because they have a chance of getting 50 as opposed to the 10 that they actually charged me. So, we got to encourage competition. We have to promote health savings accounts.
HSAs are great.
Expanding yeah, I will talk about those in our next segment here, which is options for the entrepreneurs and what they should do. Now, Nate, I want to hear what you have to say, but I think we have to divide this personally. I think we have to divide this into people with no pre-existing conditions and people with pre-existing conditions, because I do think there's a difference. Like, my family is very fortunate. We have no pre-existing conditions, like none. So we've never had a problem. Um, it's the pre-existing conditions that will get you. So I want to hear what your particular solutions are for entrepreneurs.
Well, sounds good. And just to kind of go through the gambit, because there are a lot of options. I'm a
Mhm.
huge fan of what we have set up with the concierge doctor to take care of absolutely everything other than going to the hospital.
So
You do get that direct care.
explain like no one's ever heard of a concierge doctor before. What exactly do you get with a concierge doctor? What do you pay? How does that work?
Sure, with a concierge doctor, you're actually paying the doctor for their service. It's like a subscription, but I think we pay maybe less than $200 per person in my family, way less than $200 per person in the family per month. I think it's around $600 in total for my family of four. And it's paid to the doctor. It's not paid to some insurance company. It's not paid to some hospital. There's not that multiple levels of profit that are needed. No, it's just the doctor taking care of it. And what it covers is whatever we need. For any drugs, cash pay prices, we use GoodRx. For any medical testing, we pay it directly. And because they send out these referrals and they really don't care because they're not marking it up, these concierge doctors will oftentimes find you the cheapest deal already, because
Mhm.
this is a service they can provide to all of their customers, their patients. And then what they really do is anytime anything is needed, they're available to be responsive, directly them or their nurse or their assistant. But as an example, found out that my oldest daughter, she's in tennis. She actually is starting her tennis team practices next week, and just found out today, oh, she needs a physical before the
Oh,
school
yeah.
will even allow
Yeah.
her to do it. Well, reach out to the doctor. She says, great, bring her in after school today. Let's
Yeah,
just
you don't
get
even
it
have to
taken
make an
care of.
appointment. Yeah. Yeah.
No additional expenses, no additional anything. It's just go in and get it taken care of the way that
Right.
medical service, healthcare really should be, that direct relationship. And I think that's the substance of the difference.
So, and you pair that with what we call a what is called a health sharing ministry. These are organizations. They're nonprofit organizations. Many of them have existed for many, many years, 20, 30 years. I don't know which one you use, but the ones that I know of are MediShare, which is supposed to be very good. Christian Healthcare Ministries, which I will tell you all right now, Christian Healthcare Ministries, I had them for many, many years. I stopped having them when I moved to Puerto Rico because they didn't cover what cover is a loose word when it comes to health share ministries, but they really didn't exist here in Puerto Rico. And so that was when I ended up not using them anymore. But Christian Healthcare Ministries um, covered the entire cost of my son's broken femur and the surgery, covered the entire cost of my last pregnancy, because if you'll recall, after my second pregnancy, I no longer had health insurance, and, other things like that. So, any emergencies. What are these called? They're called health sharing ministries. If you wanna Google search, I just mentioned a couple, MediShare, Christian Healthcare Ministries, and Liberty Share is one as well. So do your own research on those for sure. Find out what works for you, what's covered in some of those. Um, so that's one thing. And then I would also say, I don't know if you do this. Do you pair that your costs of your concierge doctor, do you pay for that with a health savings account?
Yes,
Okay, so explain that.
we do. With health savings account, it is a tax deductible way to actually save money that you're required to use for healthcare.
Mhm.
I actually don't think you can use it to pay insurance costs, but paying a doctor directly, such as having a concierge doctor, it goes right through.
Right.
If you're having a child and just pay cash rather than going through insurance, it comes out of the HSA, and every year, I forget the limit, but you can deposit, you can save about $7,500 tax deductible every year. And I'm sure you're going to correct me on the limit. I'm going off of memory now.
Oh, I don't actually remember what it is. I know it was $6,000 a year at one point. I don't remember what it's been since then. Um, uh, since I last checked, I just throw money into it whenever I get a moment. I don't really figure it out too hard. Um, but okay, so so
Okay,
here's
I
what
got
we're
the answer
reading.
for you real
Oh,
quick.
look.
If you're an individual, it is $4,150. If you are over 55, you can tack on another $1,000. And if you have a family, it is 8,300 as of 2024. So we'll see what it gets adjusted to this next year. But
Okay.
you can save $8,300 for your family. That is tax
Tax
deductible.
deductible. Nice.
It just has to go into this account
That's awesome. And it's your money. So sits
completely.
there, yours. You can use it for and the thing is, like, I think with those, like, you have to check this, don't quote me on this, but I think with those health savings account, you can do things like if you go to a medical spa, you can get, a medical spa massage if or, other treatments, like holistic treatments like that. Massage is probably a bad example, but stuff like that, holistic treatments or, preventative care type things can all get covered under your HSA. I'm wondering if you can pay for your gym membership with an HSA. Go look
I
into
don't
that.
think so. That is preventative care. And that's part of the problem that you just brought up is
Yeah.
preventative care really isn't covered by much.
Right. Right. Yeah. Okay. So, all right. We're talking about, so here's what we're saying to you guys. Get a health savings account. If you're an entrepreneur, get a health savings account for sure. Look into MediShares, or, health sharing ministries. And honestly, this is what I did for my employees. I just bought their health sharing ministry account. It was cheaper for me to do that than to buy a group plan insurance for my company.
And we pay for
And then
people's concierge doctors.
I did. I paid for their concierge doctor, and I paid for their MediShare. And then also look into concierge doctors in your area if there's any in your area. Here in Puerto Rico, there is a very good concierge doctor, but he's all the way in San Juan, so we're not doing that because I'm
Well,
2.5
I
hours
will.
away from San Juan. It's
And
tricky.
then the biggest hint to minimize your healthcare expenses, price shop.
Price up.
If
Yeah.
you're cash pay, you can call up these doctors or pharmacies, you can call hospitals. Funny story is when we were having each of our kids, and we've got two of them, picked up the phone and just literally called hospitals. What do you charge to have a kid there? Every one of them responded, "Oh my God, you're having a kid. Come in immediately." It was so foreign to them of like, no, no, no. I'm literally just doing my due diligence and price shopping because apparently that never happens. And my God, pretty please, if you can't rely on insurance or if you're not relying on insurance, pick up the phone and price shop. They know they will tell you what their cash price is.
Yeah. Yeah. So, yeah, exactly. So there you go. The other thing I would also say that if you do you have a pre-existing condition, something you should do is still check out the Affordable Care Act marketplace and see if you qualify for that, and do the shop thing if you have a small business and if you have pre-existing conditions because these health share ministries do not have to cover your pre-existing conditions, and they're very upfront about that, and because they're not insurance and therefore they don't have to cover it. The other part of it is the other thing you can go to too is join a professional employer organization to access group rates. Like, for example, if you belong to a realtors certain realtors associations, certain bar associations, or the American Bar Association, oftentimes you can access group rates, group insurance rates through those organizations. So look into those things as well. Now, one other thing I'm going to recommend that I have not tried, but I've always wanted to do, and I got this idea when I was walking over the border in Tijuana one day, and a guy was walking over the border as well. So I used to live in San Diego when I was in law school, and my roommate and I used to regularly drive down to the border, walk over and have a margarita and come back. That's just what we did. I don't know why. It's just what we did. We were stupid college kids. Anyhow, we were walking over the border one day, and this guy's walking over, and he's carrying a newspaper with him, just by himself, carrying a newspaper, walking over the border. I go, "Hey, where are you going?" He's like, "I'm going to the hospital." I'm like, "The hospital?" I was like, "You're walking the wrong way, buddy." He goes, "No, my wife's having a baby." I go, "In Tijuana? Is she Mexican?" He goes, "No, she's not. But it's so much cheaper to have a baby here in Tijuana, and the hospital's clean, and it's really nice, and they take good care of her. So we're having a baby down here in Tijuana. That's what we're doing." And I just couldn't even believe it. So another thing I want to recommend is medical tourism. I'm looking into this for my family. One place that I'm very interested in going to is Turkey. Turkey has some gorgeous medical spa facilities and testing facilities, and uh, I don't remember what it's dinar, or what the currency is in Turkey. I apologize for not knowing that off the top of my head, but the dollar is so strong compared to Turkish currency that everything is so incredibly inexpensive there. But I will tell you, Turkey has state of the art equipment. Another place to consider in going for medical tourism, or at least that I've considered, is Japan. And again, this goes to the relative strength of the dollar compared to the Japanese yen. So anything you do over there is relatively inexpensive. Now, there's all kinds of information online about medical tourism and where to get the best care and where to travel for what. Um, there's literally magazines called medical tourism magazines. So do your own research, see what you need, but I'm heading to Turkey, folks. So if you wanna go to Turkey with me. Oh, Turkish lira, thank you. It's not a dinar, it's a lira. Thank you.
I've
So,
heard it's the best places for hair plugs.
yeah,
So,
listen, I'm gonna come back looking like, "Ugh."
well, I'm gonna
Look,
have this
everybody,
luscious hair.
you'll know when I went to Turkey because I'll look like this. Yeah, so, no, but again, I follow somebody on TikTok who went and did all the things in Turkey, and I also saw that this couple from Great Britain, by the way, has universal health care in Great Britain, but they couldn't get the care they needed in the time that they needed for cancer, so they went to Turkey, and they rented a place, and they lived in Turkey, and they went and got healthcare, cancer treatment in Turkey. So, uh and I
Systemic
say that as
issues
somebody who's never been to
everywhere.
Turkey, so take it all with a grain of salt. All right, everybody. If you have any questions, put them in the chat below. Um, Everybody, please check out our brand new website. I'm very excited about this. Entrepreneur.com. Now, look, don't be dumb. Don't spell entrepreneur entrepreneurs like it's actually spelled. Spell it the wrong way, like we do. Hold on. I'm going to put our little link in a banner so you can see it.
Yeah, you can
Go
totally blame
here.
me for the confusion with the names, but I got to tell you, I love the name.
I love the name. I love the name. So go to entrepreneur.com, check it out. It's gorgeous. It's beautiful. And we're going to be doing so many more things. Right now, we're just doing this live stream, keeping it simple, figuring out our way, figuring out what the people require and need. And if you require or need anything, let us know in the comments below, and perhaps we'll cover it. So, Nate, you want to tell them what we're going to cover next week?
Did we
Or
decide what we're covering next week?
yes.
I was going to ask you what we're covering next week, so I think you should introduce it.
Oh, sorry. Okay,
To all of
sorry.
us.
I meant, Nate, you want to ask me what we're covering next week?
Hey, Jillian, what are we going to cover next week?
Oh, I'm so glad you asked, Nate. So, actually, what we're going to cover is if you are a person who is looking for a new home and you can't afford it, or you don't know where to find it, or you don't know how to look for it, or you feel helpless in this current market, or even if you're a budding real estate investor or a current real estate investor, I am going to show you how to use Zillow to find any property you want. I know that's a big promise, but I'm going to tell you, I have used Zillow or online resources 4 times now to buy 4 properties, which I made a lot of money off of. So, and that includes primary residences and investment properties. And I'm going to show you exactly how I did it and how you can do it too
Excited.
in any market. Yay! All right,
Super
everybody.
excited.
Any final words?
You know what? You got to choose what's best for yourself, but there are so many options that is not getting abused by the regular health insurance companies. Do your research. We're just getting started. Please make sure that you're taking care of yourself and, even more importantly, your family.